Thank you very much. I was asked to talk about integrative cardiology today, which is a kind of healing practice that I use in my daily practice in cardiology. But it is quite important to know what actually integrative cardiology means before we discuss further what that involves. But first of all, I would like to start with the word integrative medicine first, because the cardiology is a kind of specialty in medicine, and it is a specialty that has recognized the use of integrative healing practice very early on comparing to another, because of many cardiologists actually realize that treating people with cardiac disease, we cannot win. At the end, they'll always come back to us with the same condition. So many cardiologists, in particular in the US, has used a lot of integrative medicine together with modern medicine. So integrative medicine, what we mean is that we use healing. It is a kind of healing practice using both high technology but also using high touch, which is the human side of caring together with healing environment. And it is a kind of blended medicine using both in conventional medicine, which is high tech. For example, myself, I will do ballooning, stent, and bypass surgery in my group practice, even though we use another complementary and alternative medicine as well. And the practice actually offers the best healing method to each individual patient by reducing suffering and improving quality of life. And also we aim to extend that life as well as providing preventive measure, which is the most important things. We know that prevention for cardiovascular disease is very important. In the past, we just treat patients, and a lot of high-tech cardiologists, my colleague, just aiming to treat patients like an object, and they forget about what patient feeling. So we blend that all together. It's not the treatment that we ignore the high-tech cardiovascular medicine, but we actually embrace the whole thing together with the human side of feeling as well. So I am quite glad to see the session before me, that all of you actually realize what the connection between your mind, your feeling, and your body, because this thing is what we actually have to try to treat the patient. So there are many options of complementary and alternative medicine in cardiovascular disease patient when they come to see us. I would start with the very common that you might think that it is not complementary anymore now. The first one is cardiac rehabilitation and EECP therapy, in which both of these, Dr. Payanut, the speaker who follow me, will talk about more about this. In the past, for example, about this cardiac rehab, is that in the past, let's say about 10 years ago, we recommend to the patient that they should exercise, they should eat well. But at that time, we did not have any scientific evidence at all. But we believe, as a good doctor, we believe that doing that would be good for them. But nowadays, we have a lot more information in which Dr. Payanut will talk more about that. So cardiac rehab would involve exercise and nutritional counseling, and also stress management and emotional support, which, as I said, that you all know that there are connection between stress, depression, emotion, and heart disease is the one group of disease that we know the connection very well now, how these things connected. Another kind of option of treatment would be meditation. As you all know, I won't talk more about this, but I will show you some scientific evidence at the end of the talk if I have time. Chelation, detoxification, vitamin treatment is also important because if you remember the first slide I mentioned about healing environment, which is very important. In the past, again, we talk about toxic environment like air pollution, cause you some disease, cause you that disease, but we don't have any good evidence of that. But nowadays we start to know some evidence that even in the air pollution, like any smoke would cause some inflammation. The word inflammation which will lead to the heart disease. Acupuncture, we use that in cardiovascular medicine. There's no need to speak more about that because the Chinese people have used that for 2,000 or 3,000 years and it works. And now we realize that it works well. In WHO list, there are a long list of diseases that they believe that acupuncture can be used to treat those diseases. In cardiovascular medicine, that I use a lot more often is for controlling high blood pressure, which is very easy and you can reduce a lot of medication after that. Another option for cardiovascular medicine, I would go very quickly with this list because we won't have time to talk about all of this. The massage therapy, reflexology, you may have heard about some connection between particular organ in your food that can lead to some disease in your heart and other organ, and that works reasonably well. Music therapy has been used in many centers in the US and in Thailand. Herbal and vitamin supplement is also quite interesting because a lot of medicine that we use in conventional modern medicine actually come from herbal medicine. For example, you may have heard about lipid lowering agent like statin group of medicine. Actually, the same herbal medicine, which is red yeast rice, the Chinese people has used that for 100 or 1,000 years to lower the cholesterol, and they actually use that in food, in preparing food. So they actually know how to do it. They give you a lot of fat to eat. At the same time, they give you some herbal supplement in the food, so they can reduce fat or reduce cholesterol at the same time. Tai Chi and Qigong, we have used that a lot now. There are more information that Qigong practice can reduce or prevent the risk of having cardiac arrhythmia or palpitation or abnormal heart rhythm in the future. So this is a kind of exercise and meditation at the same time. I think Dr. Piyanut also will be able to give you a more information about this. And guided imagery, I think during the meditation class before this, you have some kind of experience about guided imagery. You can guide people with stress, with disease, to be more happy, and that kind of thing. Naturopath medicine, homeopathy, I won't go into detail about that. Traditional medicine, either Ayurvedic, Thai traditional medicine, and Chinese medicine has been used in cardiovascular medicine. And the important thing that I would give a little talk at the end is a spiritual prayer and some form of biogenetic treatment, which is very important because this is something that we know how to connect the mind and the body illnesses together. Well, before we go into detail about complementary and alternative medicine and heart disease, I think I need to give you a little basic about heart disease first. When we talk about heart disease, there are many kinds of heart disease that we talk about. The first one is congenital heart disease. This is the abnormal heart disease that come with you when you're born, and nothing much you can prevent about it except your mother and your parents that know how to protect that. There's some some connection between medicine and some toxicity that can lead the infant to congenital heart disease. The next one would be valvular heart disease, rheumatic heart disease, cardiomyopathy. When I said cardiomyopathy, it means that the heart is a muscle kind of organ, like the muscle in your arms, but it actually pumps blood throughout your body. So sometimes it can get weaker because of disease as well. It cannot pump the blood throughout the body very well, so that is the disease called cardiomyopathy, which can be a result of viral infection. It can be a result of ischemic heart disease as well. But the disease that we usually talk in the society now is the kind of heart disease called ischemic heart disease or coronary artery disease, which is the same thing. This is, you can see the picture on the left-hand side. This is a heart without the muscle. We actually extract the vessel, the arteries that lead the blood supply to the muscle of the heart. We have three important main arteries of the heart called coronary arteries. And when these arteries get narrowed, the heart cannot get enough blood supply to itself. So it can cause many symptoms, and it can lead to heart failure and lead to weakening of the heart muscle. So the disease of heart disease that I will talk in relation to complementary and alternative medicine and integrative cardiology from now on will be ischemic heart disease, because it is the most common disease that we encounter in our society right now because of our lifestyle change or whatever. The presentation of ischemic heart disease that patient can come to us, the most common one, believe it or not, would be asymptomatic, or they have no symptoms. When they have no symptoms, they don't aware of what they have inside, but they can come at the later with the sudden death. But if you are lucky, you can have symptoms of chest pain, chest tightness, or exertional chest pain, which we call stable angina. You may have heard about the word angina. But if the blockage is more severe, the patient can come in with acute myocardial infarction or heart attack or unstable angina. And if these things left untreated, the heart muscle will get weaker and patient will get heart failure at the end. So these are the 5 presentations of patients that usually come to us. But we actually, when we treat some disease, we want to treat the acuteness of the disease when they come to see us. But if you have time, you really would like to prevent the disease from coming back. As I mentioned at the beginning, most people with heart disease always come back with the same disease, same presentation again at the end, at the later date, whatever. So we should know about the risk of having ischemic heart disease first. So if we know the risk, we can prevent it from happening, or we can delay it from happening at a later date. The first important risk is if a patient have previous heart attack or stroke, they will have a higher chance of having that again in the future. So this is very important to know. And this is something that I will always stress or emphasize to my patient, that if once you have it, you have a higher risk of having it again. So you have to try your best not to get it by reducing all the other risk factors. The next risk factor is something that you cannot do much about. If you are male or you are postmenopausal female, you cannot do much about it because the risk is higher. So you have to improve other risk factors instead. The family history of heart disease, you cannot do much about it either. But if you are a smoker, you have to stop smoking, because being a smoker, you increase the risk of having heart disease by 2 or 3 times compared to the people of the same age. High blood pressure also a risk factor that you all know about. And the next risk factor is is something that we can do a lot about is the abnormal cholesterol, which is something that you take in obviously by what you eat. And diabetes is also a very important risk factor. And the next thing is something that you can do a lot about is the physical inactivity or lacking of exercise is an independent risk factor for having ischemic heart disease. In the past, we also, as I mentioned before, we always encourage people to exercise. A lot of people cannot exercise because of many of them never exercised before, but when they come to see us about in their middle age, they cannot exercise. In particular, women. It is very important for them to exercise during the day because of so many factors. All women knows about it. But nowadays we know that if you do walk, even simple walking, and there's a step count, that if you can walk 10,000 steps per day, that is as good as exercise. So nowadays there's a little machine that can count your step. If you walk 10,000 steps per day, that is as good as exercise. It is very difficult, actually, I must say. As a doctor that I walk around seeing all the patients, I can usually get about 6,000 or 7,000 at a time. But you can do it. If you do it more, you can do it. And being obesity is a risk factor. And having metabolic syndrome. Metabolic syndrome is some kind of new disease in modern society that you have people with obesity, high blood pressure, high triglyceride, and diabetes. This is a combination of modern society or modern lifestyle. And the last but not least is a very important risk factor in the past. For example, 10 or 20 years ago when I first graduated, I always been asked by my patient that even if stress is the risk factor for heart disease. At the time, we don't really have a lot of information about it, but nowadays we do recognize stress and depression as a risk factor for ischemic heart disease. Now, I will tell you why later. But before we go to the alternative treatment, we should also know how to treat ischemic heart disease. Conventional medicine have only 3 options for treatment of ischemic heart disease. The first one, obviously, is medical treatment. We have many medicine that if you are labeled that you have ischemic heart disease or coronary heart disease, you will have a lot of medicine that you will need to take forever for the rest of your life, because some of them will treat your symptom, but a lot more of them will prevent you from having progression of disease. So this is very important to know, and it is very difficult to do too, because a lot of patients with ischemic heart disease or coronary artery disease, they come to see us at the age of 40 or 50. You can imagine that you have to take medicine, 4 or 5 medicine regularly every day for the rest of your life. That is almost impossible. When I was younger, I said I didn't care anything about it, but then when I got older, or I know that this is very important. Most patients cannot do it, but when they cannot do it, the disease will progress. So that's how one reason I got interested in integrative medicine, because you have to try to put something else, something treatment, some other kind of healing method to the patient to help them from having to take medicine for the rest of their life to heal their disease. The next option of treatment would be more invasive, which is a balloon and stent. A lot of you may have heard about it already. It is when the arteries got narrow, we just put a little balloon inside the arteries and open it up. And sometimes, a lot of time you need a stent, which is a little metal mesh to hold up the arteries to keep it open. This is a very, very modern kind of treatment, and it is very effective too. It can save your life. It can reduce the symptom very effectively. But if you cannot do it, the bypass surgery, which is the next option, it is more invasive as well. But one thing that patients usually get misunderstand is that when they have bypass surgery, everything is as good as new, which is not. They still have to take a lot of medicine for the rest of their lives still, because they have to prevent disease from coming back. So this is again very important. So talking about stress, I think you may know a lot about stress now, but in terms of cardiovascular medicine, we know that being stressed, it can raise your blood pressure, and it make you overeat, and it will make you obese, and it will make you will make you physically inactive, not much exercise. It gives you abnormal lipid levels, and it's more likely to make people smoke. You may have heard people maybe telling you that they smoke because of their stress, and it gives you obesity. So all these things lead to heart disease or ischemic heart disease, as I said before. This is all the risk factors. So stress has a reasonable connection and lead you to ischemic heart disease through all these measures. But this is a cartoon that will, in the past, we as a scientist or as a modern doctor, we don't only believe that stress can cause high blood pressure, and high blood pressure will lead you to ischemic heart disease. We have to see something in the laboratory as well. So this is a kind of modern knowledge that we know how these things connect. I won't go into detail, but this cartoon actually depicts that the link between this is the inflammation. The stress can increase the inflammation process in your body, as well as the lipid collection in the blood vessel. Because this is another diagram to show you that stress can cause the catecholamine increase. It can give you insulin, make you have insulin resistance, give you high blood pressure, give you high lipid. But the link between all this is the inflammatory marker, which is called interleukin 6, which we have realized now. At the end, as I said before, it will lead to the ischemic heart disease or coronary heart disease. So it is very important to know also that emotional distress and stress can imitate cardiac symptoms. A lot of patients come in to us with complaint of difficulty breathing. A lot of patients with stress can come in to us and saying that, look, doctor, we cannot breathe. And this is the same complaint of ischemic heart disease. It actually can accentuate improper lifestyle and risk factor burden of heart disease, as I mentioned before. And nowadays we realize it is an independent risk factor for coronary artery disease already. And having a very rapid trigger of emotion can actually cause heart attack. I have come across many people who has very high stress in their life, and then a few days later they come in with heart attack. This is not unusual that we will see that. And very important to know also, when people come in with acute cardiac event, for example, heart attack, they will have a lot of stress. Obviously, they will have a stress, and that will give you more or worse outcome if people with heart attack have stress. And it serves as a barrier to accept many treatment. A lot of people, when I explain to them that they have heart attack, they have this, they have that, and they will have to take the medicine for the rest of their life. You can imagine yourself lying there in bed, having heart attack, and doctor come to tell you that you will have to change your lifestyle. You get stressed, right? And that is not good to them. So this is how why nowadays a lot of major institutes around the world recommend the lifestyle modification in cardiovascular disease by stop smoking, reduce blood pressure, lower blood cholesterol, blood sugar control, take medicine. But lately, every all of them have the stress management as well for people who come in and have coronary artery disease, in particular those who come in and admitted to the hospital with very acute and severe event. They recommend stress management. But this is something that modern hospital or even in Thailand or many Western countries hasn't included that in the usual treatment yet. But actually it has been recommended by many major institutes around the world now that stress management is very important. This is either World Heart Medicine Cardiology, European Cardiology, and even American Heart Association. They all recommend stress management as a part of medical treatment for those who come in with acute cardiac event. So I don't have to emphasize more to you who are interested in this kind of healing method that there is a good relationship of very tight relationship between body and mind, in particular in cardiovascular medicine. And in Buddhist, we know that balance of your body, imbalance of your body is the illness. Imbalance of your mind is also the illness of your mind. So it is my belief that if you want to have a healthy life, you have to have a balance between both of your body and mind. And that's how I think complementary and alternative medicine come into practice with cardiovascular disease. Because the uniqueness of CAM treatment is that we tend to focus on patients to stay well, not only treat them with physical illness. We don't just treat them with heart disease. We not just open the arteries up and let them go home. And so they want them to feel well with less stress and more understanding of their illness, so they can prevent what the disease from coming back. We emphasize the patient's feeling as well as the illness of the body. And as a modern doctor, I must say that you may have heard the word placebo effect. When we do trial in medicine, there's a certain improvement of a patient who receiving placebo, not an active treatment, and they got better. As a modern medicine and modern scientists, we just ignore that and said that is nothing. But as a CAM practitioner, we acknowledge that placebo effect is a power of your mind that can do many things to your body. And we also stress the role of self-care to the patient, the CAM treatment. And many patients receiving alternative medicine, they want to be involved in their own care, which is good. I think to treat patients well and let them stay well, they have to take care of their life after they leave the doctor or the hospital, because obviously they spend more life with themselves, not with the doctor. So, but the fact about CAM, the alternative medicine, is that many modern doctors actually refuse it altogether. Don't even want to hear it. If you go to see a modern doctor, they will not listen to you. But the fact is that in the year 2000, almost 50% of U.S. citizens sought help from alternative healthcare practitioners, and millions of visits to treatment every year, even in the U.S., and they spend a lot of money. And the survey also show that more than half of people actually been used alternative medicine, even in the US. And that's why nowadays more than 25 major medical centers in the US actually involved in complementary and alternative medicine, whether you know it or not, but they have their alternative medicine offer and they do some research about it because now they want to give the best to the patient. This is just a sample of the treatment, the use of CAM treatment in the US. You may see that a lot of people use alternative medicine, even using vitamin, and a lot of them use prayer as a part of healing method as well. But even more interesting though, this is difficult to see, but I can tell you that when they survey a lot of physicians in the US, this is doctor in the US, and almost half of them have used alternative medicine and have used a lot of supplement as well, but they don't offer that to the patient. You can imagine why, because there are a lot of very tight regulation that they cannot offer this to the patient, which is, I don't know whether that's good or bad, but the regulation is, they believe it themselves that this works, but they cannot offer that to the patient because there's no guideline, there's no law that they can offer this kind of treatment to the patient. So there are, again in the US, there are many alternative treatment that patients with cardiovascular disease has sought and has used for their treatment, either herbal treatment, relaxation technique, massage, yoga, and even special diet, vitamins and homeopathy and Tai Chi, which is actually, I think, would be very more popular nowadays, to use Tai Chi and Qigong as a part of treatment for cardiovascular disease. Well, but as a doctor, as a conventional doctor, I think I just look into my perspective of CAM treatment. I think this is what we have to look for. The CAM treatment should have a favorable risk and benefit ratio compared to other treatments. Obviously, if they're not good enough, we will not use it. There are many treatments that we can choose to use. It should be based upon a reasonable expectation that it will result in a favor patient outcome, in particular in prevention. I think this is a very good things about alternative medicine. They use a lot of prevention method to prevent the patient from having the disease again. The CAM treatment should be based upon the expectation that a greater benefit will be achieved than that which can be expected with no treatment. Because a lot of patients who come to doctor like myself will refuse some invasive form of treatment, in particular surgery. And as I mentioned before, many patients, when they have to take medicine regularly for 20 or 30 years, at the end, at some time, they will stop taking medicine. So to use CAM treatment as an alternative, we should be sure that using it is at least offer patient more than nothing at all. And it should be based upon a reasonable scientific explanation and pathophysiology of the disease that we are treated, which is nowadays we have a lot more information about that, as I told you earlier. But there are two aspects of CAM treatment that we should think about before we, as a doctor, to offer that to the patient. One is the ethic issue, and the other one is the legal issue, as I partially mentioned that to you. The critical legal issue is that the license issue is very important. You know, if I am a doctor, I train in paper said that we can offer anything to the patient. But if I go and do acupuncture, whether that will be accepted or not, I'm not sure. This is a picture of what we call Lao Tzu that when I went to China about 10 months ago, I walked to the mountain. This is Tao Mountain, which is very famous in Tao practice. And he actually just looked at my hand and asked my birth date. And at the end, he just told me what my health issue is correctly, believe it or not. And he told me what I should eat and what I should not eat. And he also told me about exercise. So this is something that so who actually controlling this? But he's right, but who knows? He may be wrong, but the other person, there are many of these on the way when I walk up to the mountain, but many of these on the way. And I don't have to pay anything. They don't ask for any money. They do it for free. So when regarding your health, so we need a legal issue about this? I mean, a law to control this? I'm not sure. So there's something but anyway, there's something to think about. And also, as a modern medicine, we have a professional discipline to control us. But this kind of practice, you don't have any discipline. You don't have any society to control you. So that's why at the end, there are many fraud about this kind of practice. And this kind of fraud actually make this practice, give it a bad name, even though it has good things about it, a lot of good things about it. But business, I said business make it worse. But these kind of things in our Eastern world, I think there are more to learn about and more to talk about and more to use about it too. But to use CAM treatment, there are many other ethic issues that we should also consider. To my experience, most of the CAM treatment or complementary and alternative medicine treatment is a kind of treatment that it will take some time to see the effect. Unlike modern medicine that you treat it and you see the effect very quickly, like for example, like surgery or balloon. When you treat it, if you success, that's it, patient gets better. But any kind of complementary medicine, it will take time. So to my experience, I don't usually recommend and use CAM treatment in people who come in with very severe and acute illness, because that would not do any good. That would take some time. Another ethic issue is that safe and the side effect of the treatment. A lot of this kind of treatment come and advertise that it can cure everything. I think that's rubbish. No treatment can cure everything. And a lot of them will also say there's no side effect. That's again, I think it's rubbish. No treatment it will always have side effect. Like modern medicine, everything is the same. It cannot cure everything. So this is how integrative medicine and integrative cardiology come into practice, because we actually choose particular kind of healing method that would serve best to that particular patient. This is the practice of integrative medicine. We don't give them everything, we don't offer them everything, but we spend time with the patient and then we see which one would be the best to them. The reason I'm saying that it is difficult because the modern medicine, we always believe, you may have heard some word about randomized controlled trial, which is the bottom line of modern medicine, that we have a control group and treatment group, and they separate blindly, and both those who being treated and those who treat will not know what kind of treatment they have. And then at the end, we measure the effect. This is the treatment that we call randomized controlled trial. But you may know, or you may think, as I believe that it is very important or almost impossible to do that in a lot of complementary and alternative medicine, because the double blind is not possible in body and mind connection. People who being treated will always know what you treat, and people who treat will know exactly what you treat. So this is impossible to be a randomized controlled trial. So we have to find some method or some other statistical or some other scientific method to measure the treatment effectiveness of the treatment of complementary and alternative medicine. But we actually some people have tried to do that. For example, the prayer and cardiovascular disease effect. There has been some trial in the past. In early 2000, there is a randomized controlled trial of almost 1,000 patients who admitted to coronary care unit. CCU is very sicky patients, and they actually divide patients into two groups without telling them, and they give one group, they give the name to another priest far away, and they pray for them. And at the end, they measure the outcome of the patient who being prayed for, and the other group is nobody pray for at all. This is quite interesting study, but at the end, it is very difficult to see, but I will tell you, at the end, when they measure the outcome, they see the patient score, the CCU score. It come out that the patient who are prayed for remotely has a better score. It means that the disease got better, and they can measure it, and it is statistically significant. So this is very interesting to know. So there are some attempts to do measure the effectiveness of this kind of thing as well. And there is another, this is called meta-analysis. The Cochrane database is a database in the US that they will look at all the studies of the same study. They look at 10 randomized controlled trial study which involve more than 7,000 people. But when they look at this effect of prayer for the patient, it comes very confusing. A lot of they show some slight difference for the death at the end, but not a statistically significant related to clinical outcome or complications. But one study shows significant 36% reduction in bad score, like the one that I mentioned before, and the other one show only slight reduction in score in the ICU score. So for modern medicine and modern statistics, the remote prayer is still very controversial, but there are some studies, some results suggest that it might be helpful, and there's no significant side effect, and it doesn't cost much at all. It doesn't cost anything, and this is something that we have to think about when we offer to the patient. What about meditation? I think all of you here in this room believe in meditation already, but meditation and cardiovascular disease also has been studied. This is a list from Mayo Clinic, which is a major cardiac institute in the US. It has a list of conditions that being treated with meditation, and they offer meditation as part of their healing practice. Many diseases that can be treated with and got better with meditation. And there is also a randomized controlled trial of transcendental meditation, which is a kind of meditation in coronary heart disease. This is a study that they look at stable coronary heart disease, almost 100 patients, and they compare transcendental meditation and normal health education. And the objective of the study, they want to look at the blood pressure, insulin resistance, and some function of the vessel. And they do it twice weekly for 4 weeks, and then they measure the outcome. And this is the two group. There's no significant. I will go quickly. But at the end, what they can measure, they can prove is that people with transcendental meditation has a better blood pressure and has a better insulin resistance, which is a kind of lead to metabolic syndrome and diabetes later on. So this is some beneficial effect of transcendental meditation when we use the modern method to compare the kind of two treatments. And also there is a meta-analysis. As I said, they look at the treatment of high blood pressure of people with transcendental meditation. They come up with the number that people who receive transcendental meditation, they have 23% reduction in all-cause mortality as well, which is quite interesting. And a 30% reduction in cardiovascular death and 49% reduction in cancer death, which is very interesting. And this is just a simple way, or not just the usual way that we look at the effect of transcendental meditation. The above, this is the compare transcendental meditation and combined control usual medicine. You can see the separation of the curve. That means that at the end, they follow the patient for 10 years and 20 years. About 10, they can see the separation of the curve. It means that the transcendental meditation make you live longer. That's all. So I just want to summarize and conclude here that integrative medicine, or you can call it integrative cardiology, in my practice, that it will provide the best of both worlds to the patient. We use both. We don't deny anything, and it treats both disease of the body and the feeling of the mind of the patient. And as a practitioner, you will have more time spent with the patient to give a higher degree of touch and preventive measure, which I believe is very important. And obviously, so many people talk about this alternative medicine. It costs less, and it has less side effect as well. But you have to remember that the effect of the treatment is quite slower than the conventional medicine. So I might stop here and let my next speaker tell you a little bit more about some other form of alternative and complementary medicine that we use in cardiovascular patients. Thank you.
I'm Dr. Pianut. He's my boss actually. We work together for almost 15 years, and I'm also a conventional doctor, specialized in rehabilitation medicine. My specialist is cardiac rehabilitation, and I also treating pain patients. As you can aware of, this kind of two groups of patients, cardiac patients and pain patients, is a chronic disease. That means it's very difficult to make it cure, or maybe for some patients there will be no cure at all. They will live with the disease. So I also, Dr. Niti mentioned about that he treat patient and then he stuck with like the treatment that we have in hand as a conventional medicine. That's happened to me too. So I have a chance to study in the fellowship program of University of Arizona. What you see in the picture is Dr. Andrew Y. He's very renowned conventional doctor from Harvard University. That he dedicated himself to study to treat patients with a natural way. and he set up the integrative medicine. I think up to now it's almost 15 years. So it's a long time ago that integrative medicine has involved in Western medicine. We just recently used the integrative medicine. A few years ago, Dr. Niti actually he used the name of integrative medicine as การแพทย์ผสมผสาน in Thai, because I don't know that the right word or not, but it's better than การแพทย์ holistic in my belief, because it's when you see the terminology that you may heard of. Usually we will heard about alternative medicine. What's the difference between alternative medicine, complementary medicine, and integrative medicine? There is a little bit different when you use this kind of terminology. Alternative medicine, and I highlight that in red. What's the difference? Alternative medicine, that means you use only the alternative medicine instead of using the conventional medicine. Let me make an example that the patients have hypertension. The alternative medicine specialist or doctor will use only the treatment that he has in hand. For example, acupuncture. So the patients that have hypertension or high blood pressure using alternative medicine may use acupuncture only. For complementary medicine, it's using non-conventional approach together with the conventional medicine. What is mean by that? That means that this patient, the same one, when the healer or the doctor use chem treatment, that means he may use a conventional treatment, for example, medicine with acupuncture all together, in the same times, that kind of thing. But the integrative medicine, we will use the non-conventional medicine as a part of integrative medicine. So what's the difference between complementary medicine and integrative medicine? For this patient, integrative medicine doctor may consider using acupuncture at the very beginning of his high blood pressure without any medicine at all. So it's the part of the treatment. It's not the treatment that together. You understand what I try to explain? So for the integrative medicine doctors, they believe that alternative treatment may be solely treat the patient without any medication or any surgery. So this is the concept of integrative medicine. I will go over what Dr. Niti has mentioned in detail. The National Center of Complementary and Alternative Medicine, or NCAM, this is the organizing committee in United States that look at the complementary and alternative medicine. They divide this CAM treatment into 3 categories. One is the natural medicine, which is like botanical supplementation or nutrition. Second is the mind and body medicine, anything that related to mind or anything that related to body movement. For example, like acupuncture, Tai Chi, Qigong, that kind of thing. And the others, that mean cannot be put into these 2 categories. They will put in others, which is a lot, like traditional Chinese medicine, naturopathy, homeopathy, and also Ayurvedic medicine, or in Thai we call it Ayurveda. And you will see that this kind of treatment has been using for a long time, even longer than the modern medicine that we use now, which considering that the history is about few hundred years ago. Like Ayurveda medicine may be like how many thousand years ago already. We just lack of modern scientific information that make the doctors in the conventional believe in. And the last one that I mentioned is the advanced medicine. I don't know how to call it, but it's the kind of medicine that more like conventional medicine, but there is less evidence that conventional doctor usually use, like Dr. Niti mentioned in one slide about a randomized control trial. This kind of treatment, you may heard about it, something like stem cell, chelation, or that kind of thing. Still considering in the alternative treatment of medicine. But today, I will only mention about on this slide. And with the natural medicine, I will focus on anti-inflammatory diet and cardiac rehabilitation and exercise, mind and body medicine, and a little bit of supplement chelation and EECP, which we use now. You saw this slide before. It's about the inflammation. So cardiovascular disease, especially the coronary heart disease, is not just the blockage of the artery anymore. It's a systemic disease. It's the problems of inflammation in the body. And how we know that? We know that because on the list of the right-hand side of the slide is the marker of inflammation that you can test from your blood. And the paper or medical research also show that the cardiac patients or any disease that related to cardiovascular disease like diabetes, like hypertension, also has increased the inflammation marker. So that's why we know that it's related to inflammation, not only the blockage of artery. And the treatment of conventional right now is just blowing the balloon or surgery, which may not be enough for the patient. We're going into the anti-inflammatory diet. This is from Dr. Andrew Y as well. You will see it will different from the pyramid of food that we usually see, either from our Ministry of Health or even the US Ministry of Health. What you see is that at the bottom of pyramid, the bottom ขอโทษนะคะมี pointer ไหมคะค่ะ The bottom of the pyramid, you will see that we can eat a lot of it. Okay? At the top of the pyramid, that means we should eat very little. And please notice that the bottom of the pyramid here is fruits and vegetables. I think everybody knows that we should eat a lot of fruit and vegetable, right? But you see that this pyramid, this is that what we use now, and most of the world use this kind of pyramid. You will see at the bottom line of the pyramid is the carbohydrate, right? Either rice, bread, or pasta. And it's still on the bottom of the pyramid. This is as well. This is the new version of the U.S. health recommendation. But you will see that the orange line, which is the biggest one, still be carbohydrate. This may not be right in terms of helping decrease the inflammation for the patients. Come back to the anti-inflammatory diet again. See, fruit and vegetable, and then carbohydrates, which is the whole grain, either brown rice, either spaghetti with whole grain, or bread, whole grain bread, and then pasta and beans, legume. Healthy fat, that means the fat that come from good oils, which I will talk to you later, and also nuts, fish and seafood, not other kinds of meat. Fish and seafood will be main protein that they recommend. And then whole soy food. We live in Asia, so soy is not very difficult to find. But in Western diet, it is very difficult to find this kind of protein. Cooked Asian mushroom, I will talk more about in detail. Why he put cooked mushroom in this one, and other other source of protein which recommend eggs, cheese, or poultry, that means chicken or duck or that kind of thing. They not recommend the red meat. Okay, and healthy herb and spice, which we use a lot in Asian food anyway. Tea, supplement, red wine, and healthy sweet. Anybody use this kind of food pyramid or upside down? Maybe upside down. Okay. Yeah, we start with the healthy sweet, which the lady in front said it's the bottom of the pyramid for her. Healthy sweet here, how much? Sparingly, that means as little as we satisfy. Okay, and what is the healthy choice? It's the dark chocolate and dry fruit. Anybody use this kind of sweet at all? Yeah, only kind of sweet, or eat something else like bakery too. There is one here sitting here and just give a talk. Dr. Niti eat this kind of thing in the morning. Okay, it's his healthy sweet. What is had in here is the polyphenol, which reduce the inflammation. That's why it's put on the that you can have the sweet as well, as the sweet has some health benefit. Never or rarely just a bite. Just a bite, not a whole piece. Okay, and it's rarely. This is Thai sweet. This is like, yeah, I know a lot of, we love this one. Yeah, strawberry cheesecake. The second line is red wine. How much? Optional. That means if you don't, it's good for health. There is a benefit that's shown in the medical paper, but if you don't drink alcohol, don't try to start drinking it. Okay? You can eat something else in the food pyramid. This is just one. Okay? It's optional and no more than 1 or 2 glasses per day. The healthy choice is organic red wine. Why? Why it has to be organic red wine? Because if the wine made from the grape, that's not good. That means there is some pollutant, some toxin in it, especially the fine cadmium and arsenic in the grape that and in the dirty soil or the soil that have heavy metal on it. This kind of heavy metal will go into wine that we eat. So that's why they recommend the organic red wine, which is a lot more expensive than regular one. Okay. And what the wine have is also the antioxidant called polyphenol and resveratrol. Tea. I think all of you have heard about the health benefit of tea, and it is. And the recommendation is that drink it hot. Not iced green tea, not iced matcha, which is very popular in Thailand now. It has to be hot and no sugar add. It is like controversial that you should put milk or not, because in traditional way, European drink tea with milk. But still recommend that drink it hot and purely. The difference between white green oolong is that a lot of paper favor green tea, and that may be because in Japanese they drink a lot of green tea, and a lot of research come from Japan. Lately, most of the specialists who specialize in tea drinker, that kind of thing, they recommend white, green, or oolong. That's fine as well. Everything is fine as well. It depends on what you like. Herbal tea is not this kind of tea. Herbal tea has there is no caffeine, there is some kind of antioxidant that different from the tea that we talk, but it has the health benefit as well. Okay. Healthy herb and spice, how much? Unlimited. That means you can have it as much as you want and you don't have the problems with it. And you see a lot of spice and curry. What study most is the curcumin, which is cumin in Thai, which is very, very good in terms of reduce inflammation. And also garlic has a lot of study as well. Other source of protein, this is a lean meat, lean chicken, and milk and cheese. How much? 1 or 2 serving per week, and this is the amount of 1 serving. Yep. Healthy choice is the natural. Mentions about natural and free range fat. That means you should choose the farm that raise the chicken freely and happily. I don't know that we have in Thailand or not. Or maybe you have to raise the chicken by yourself in your backyard. And cook mushroom. Dr. Y recommend the Asian mushroom instead of the very expensive one like portobello mushroom. He said he recommend this because a lot of study, including the study from Chinese and Japanese, showing that this kind of medicinal mushroom, which named here, has the anti-inflammatory, antioxidant, and anti-cancer, antibiotic. So you can either have it as a fresh one, not fresh, that means cooked already, but like a food, and also from the supplement. Okay. Whole soy food. This is I don't have to talk a lot about soy. I think we all like it. And the problems of soy from the Western is that the way they prepare it is different from what Asian way. And the recommendation is that try to eat it as the Asian preparation, like tofu that we have, still have it, but not as popular as, how do you call that in English though? Egg tofu? Tauhu kai is different from this kind of thing. Has to be tofu that made from soy only. Okay. And if the soy milk, that means what we can find in the market, our fresh market, that put the soybean and press it and boil it. That's the way that we should eat soy food, not get the what? Cannot think about English word. Not buy from the supermarket with the bottle, like UHT soy milk. That's not good for your health, okay? Use the fresh one. Fish and seafood. This is the main protein that you should use, okay? Not red meat. How much? 2 to 6 serving per week. It's like an everyday that you should get this protein from your food. And the problem is fish. Now we found that they have a lot of toxic substance in it. Okay, so be careful about eating fish, especially eating the same fish every meal. My recommendation is that you should change the type of fish that you eat. Not eating tuna can every day, which is maybe not good for your health as well. Okay, change the type of it. Healthy fat, this is the healthy fat. 5 to 6 serving per day. This is not the low fat diet. It's the not high fat but not the low fat diet. But the point is you have to choose the healthy fat instead of the bad one. The bad one is like the oil that we use again and again, and oil that we use for deep fry and put the food for a long time. The oil that like from made from soy, maybe not as good as rice bran oil. Use rice bran oil, use olive oil, and also nuts is very good fat as well. Okay. Whole grain pasta, beans and legumes. This is the where you can get your carbohydrate, and choose be whole grain. Okay. The pasta, rice, we know we eat rice every day, so we know that brown rice is better than white rice. Why is better? Instead of they also has more fiber, and also the brown rice, when you eat it, it gradually increase your blood sugar level because it's low glycemic index food. The low glycemic index food will reduce the inflammation. Or the other way, the high glycemic index food, or the food that when you eat, it make your blood sugar rising very quickly. It will favor the inflammation in the body. The high glycemic foods such as the soft drink, anything that has pure sugar in it, that's a high glycemic one. Pasta al dente, that means when you eat pasta or you cook pasta, you have to make it more like not too soft. You have to make it more like Italian way. Don't eat like Thai way. Make it more Italian. Yeah. It will be a little bit not too soft, and that will make it more low glycemic index instead of the soft pasta. And beans and legumes, try to put it on your meal every day. Okay. Vegetable and fruits, a lot for every day. Be careful about tropical fruit that we have and very delicious, like rambutan, durian. Okay, this is very sweet. You cannot have it like 3 to 4 serving a day for every type of tropical food that we have. That's not good for your health as well. Look at Thai food. It's the anti-inflammatory diet already. When you see Thai food that we have, see? So maybe eat like what our ancestors eat is a better choice of healthy living. Okay, we go to the second part, the cardiac rehabilitation and exercise. I will not go much into detail, only summaries for you that exercise is good for your heart. Then there are 2 types of exercise. One is this kind of exercise that we familiar with. This is the exercise that have most study showing that it's good for your heart. It's the Western exercise, I will say. I will separate it into type of exercise. One is the Western exercise. So it's this kind of thing. It's walking, running, weight training, bicycling. There's a lot of study. No doubt that it will help you if you have problem with heart disease. This is the study showing that this kind of exercise, like Western exercise, will help reduce mortality or death about 13 to 27%, which is a lot compared to some medication. And also they can reduce recurrent myocardial infarction or recurrent cardiac problems by 17% and decrease hospitalization and also help reduce the problems of the risk factor that related to coronary heart disease like lowering the cholesterol, help controlling the hypertension, help quitting the smoking and improving the quality of life. So it is no doubt now, and every cardiac patient should be advised to start exercise if they don't have any contraindication to do it. Okay. For Western exercise, we categorize into the aerobic exercise. The definition is any kind of exercise that have the movement competitively for continuously for quite period of time. For health benefit, we suggest at least 10 minutes of continuously moving. So into the definition, there's many kind of exercise like walking, running, bicycling, aerobic dance. This kind of thing can be aerobic exercise. Secondly is the resistance exercise, any kind that increase the weight training to your muscle. This also the kind of exercise that help the cardiac patients to get health improve and also help reduce the mortality when including with the aerobic exercise as well. And the important thing is the warm up and cool down. It's important for everyone, especially in cardiac patients, because it will reduce the complication that can happen with exercise. As you may heard that like football player die in the field, the marathon runner die when they run. That kind of thing can happen. And this can be reduced by warm up and cool down properly. We go to the third, the mind and body exercise. I will only talk about acupuncture, Tai Chi, Qigong, and stress management. This is the mind body exercise. That the study that has used this kind of exercise in cardiac patients, they use mostly Tai Chi and Qigong and yoga as well. The benefit of it, including the reduced blood pressure, improve exercise capacity, improve health fitness, and reduce BNP. That means that's the cardiac enzyme showing that the heart failure patients getting better. And reduce inflammation. So study, I also use study in the cardiac patient as a coronary artery disease patient and also the heart failure patients. They are more accepted now in the Western world. For us or in Asia, we also know that it's good for health for long time ago. Okay. I myself would recommend patients to do both. Asian exercise like Tai Chi, Qigong, and also the Western exercise. I think both get the benefit for the patients when you combine it. Okay. Next is the acupuncture. This is the list of acupuncture that the WHO studies recommendation that acupuncture works for health benefit. The highlight for this is the essential hypertension, okay, which is related to what we discussed right now about cardiac disease. But you will see more, at least almost 20, that the WHO recommendation that you can try acupuncture as the sole treatment. Okay. So the study in acupuncture and heart disease, hypertension, work in mild to moderate hypertension, and in the study, they have seen that about 70% of the patients can improve. Note that it should be mild to moderate hypertension, not moderate to severe hypertension, which I think it's maybe better combining the medication and acupuncture when you treat the patients. Cholesterol, obesity, smoke cessation, myocardial ischemia, and peripheral artery disease. They all has the study support that it's work. Okay, but like everything in medicine, that works that not mean 100% work. It's work for some patients, maybe not work for some patients. Stress management. What Western world use is biofeedback. What we use, like you start the day with a meditation, guided imaginary with Dr. Mano, that is one kind of stress management. This using more machine, but I think the concept may be the same as we do meditation. This called biofeedback machine. What biofeedback means is that the process of the subject, which here is the patient, learns to consciously regulate a given physiologic target variable. What is the one thing is has to be consciously. That means you put your mind on it. Other terms, it's more like meditation, right? Secondly is that you have to regulate the physiologic response. In this treatment, what we do is that ask the patient to concentrate on the breathing, either concentrate on the, in Thai may see like yuk no pong no or something like that. If you get used to like meditation, and some patients will ask to focus at their own heart instead of their diaphragm or their abdomen. Maybe it's easier for them. Or some patients will ask to breathe. You see the graph here. It's very easy for the patients that are not familiar with meditation. Ask to breathe in. You see little ball here. The little ball here. When you breathe in when the ball up. Breathe out when the ball down. Breathe in when the ball up. Breathe out when the ball down. This is some kind of meditation. You concentrate on one thing and follow the instruction. The Western medicine is good enough to make something that you can touch. When you're talking about meditation, sometimes when you meditate, you don't know that you are really in meditate or you sleep, right? But this, they will show. There is a graph showing that you are on the state of concentration or you're out of concentration already. Fantastic, right? Yeah. And it's easier for the patients to practice, and it also shows that it has the health benefit. It moderates parasympathetic nervous system, increase the cardiac output, reduce systemic vascular resistance, decrease respiratory rate, and decrease systolic blood pressure. This kind of thing showing that when you practice long enough, it helps improve your cardiac function and cardiovascular system. So in terms of us, if we don't have this machine, is apply that meditation is good, okay, for our health. The last one, chelation, ECP, and supplement. We start with ECP. We use it now in our center. This is the kind of treatment that has been invented 50 years ago, not just happened. Okay, it's long time ago, and the concept is very simple. The patients lie down on the bed, hook him with the ECG to check his heart, showing in the screen on the screen here, and this is the cuff wrapped around his leg. Under the bed or inside the bed, there is the pneumatic pump up to the cuff here, like when you go to the hospital and they check your blood pressure, the nurse checking your blood pressure, something like that. But it is more sophisticated that the machine pumping the pneumatic pump ลมยัง ลมอะค่ะลม yeah pump the air into the cup synergistic with the time that the heart pumping. So that's why they have to measure the ECG. The concept is that you're pumping the blood back to the heart and makes the blood and makes your heart getting more blood and make it stronger. It's the simple concept like we run. When we're running, our calf muscle, our leg muscle is the one that's pumping the blood back to our heart. Okay, but this is like passive exercise. You just like you are too easy to go running, and the machine will help you. Okay, and it's turned out to be that it's good for your heart. Okay, but I would not recommend only do this without exercise. Yeah, don't make me wrong. Yeah, I don't know that this movie will run or not. Yeah. Yep. Easy? Yeah. Yeah, it's simple, it's non-invasive, but it takes time. At least the patient has to continuously doing it like 35 sessions, which means each day per week is about 5 to 6 weeks. Okay. And again, it's not the magic treatment. You need to choose the patient. You need to combine this treatment with something else as well. This is the benefit of ECP from the medical journal. It's reduce chest pain, improve exercise capacity, help control blood sugar, help control blood pressure, improve brain circulation. And now the ECP treatment study move on to help stroke patients. Yep, increase blood circulation to the brain. Yep, study is going to be more in some kind of degenerative disease like Alzheimer, like Parkinson. We still need to wait for the result. And also erectile dysfunction. They have studied as well. Chelation and heart disease. What is chelation? Any of you heard about the word chelation before? Yes? Yes. Okay, the chelation. The heavy metal, the bottom line is that heavy metal are related to cardiovascular disease. What is the heavy metal that usually related to heart disease? Is like lead, mercury, arsenic, and cadmium. And a lot of paper showing that it's related. Where we get it from the environment that we live now, either from air, either from lipstick that we use, skin lotion. And on the news yesterday, I've heard about some tam thad, no? Yeah, have cadmium on it. This kind of thing happen. Okay, we get it, and it's related to heart disease. Chelation is the therapy for remove heavy metal from the blood. It involves intravenous injection of the chelating agents by to heavy metals into the blood and help excrete it in the urine. Basically, it's kind of treatment that you sit on the chair, they put the IV in you. In the IV, they have the chelating agent. It's like the medicine. It's like when the doctor prescribes the antibiotic for you by IV administration. But instead of putting antibiotic, they put chelating agent. And it's help remove the heavy metal from the body. And it's used in integrative medicine with some evidence support, but not well accepted in conventional medicine. But anyway, this is a trial. It's called TAC trial. It is a study in the chelation post-myocardial infarction It's a 10-year study trial and it's just come out a few years ago. It's the double-blind randomized control trial. The primary investigator is the cardiologist. He is the cardiologist in the conventional study. And it's a multi-center study of more than almost 2,000 MI patients. And they see that it's improved in terms of heart health, hospitalization reduced, heart attack, stroke reduced, and death reduced. So there is a proof that it helped the heart patient, but it just has to wait for the conventional doctor to accept. Like me, start doing the exercise of cardiac rehabilitation for almost 20 years. First 10 years is very difficult for me to talk to cardiologists that exercise is good for your patients. You imagine about talking about exercise and has the doctor said, no, it's not good. 10 years, only 10 years ago. Yep. So this kind of thing, I will believe that in the future, you will see it's more used in the heart patients. Last one, supplements. There is a lot of supplement that claim that good for the heart. I pick only the one that has more study. One is fish oil. Everyone heard about it. The choice is that you have to get the good one, good quality. Remember, we talk about the heavy metal on fish, in fish. They also can be in your fish oil supplement if you don't choose the good one. So be careful about that. Coenzyme Q10. If you remember one slide that Dr. Niti showed, that the doctor, what kind of chem treatment that the doctor used. Coenzyme Q10 is one of the things that the doctor usually take it, including me. Yep. And also they recommend that anybody that taking the cholesterol lowering statin medication should take CoQ10 to reduce the side effect of it. B vitamin, complex B vitamin, vitamin C, and curcumin. I talked about curcumin before. Yep. So this kind of thing has most study recommendation for the heart patients. And finally, I will see the integrative medicine or integrative cardiology as a jigsaw. You have to put the right piece on the right place and in the right patients. And I don't believe that only one treatment is fixed for everyone. It's the doctor art and also working with the patients as well to get the pictures complete. And then, oh sorry. Okay, that will be all. The last slide, I think there's the quote from Hippocrates stating that anything that you put on the patients, you have to consider two things: either make the patients better, or at least do no harm. And I think that's very important when you start using with either conventional medicine or alternative medicine or integrative medicine, whatever. The first thing that should do no harm for the patient. Thank you very much.
I have two questions, one for Dr. Pianut and one for Dr. Niti. To Dr. Pianut, is it true that there is two types of CoQ10? One is more effective than the other. And to Dr. Niti, as regarding to statin, the fat-reducing medicine, it seems that nowadays most physicians would prescribe statin to patients even with normal lipids level, with only slight high blood pressure, that person will be prescribed. So I would like to ask you, what is your criteria if you were to prescribe statin in terms of risk versus benefit. Thank you.
Yeah, thank you so much. I would take the question first. For CoQ10, there is two types of CoQ10. One is called just CoQ10. The other one called ubiquinone. The ubiquinone form claim that they have more, in terms of absorption and efficiency, it's better than the regular CoQ10. And some study shows that as well. The problem is the ubiquinone is very expensive compared to the regular CoQ10. You can either choose, personally, you can either choose ubiquinone or CoQ10. If you don't mind paying more for ubiquinone, which may be like the same amount, maybe 3 to 4 times more expensive than CoQ10, then choose ubiquinone because the study show is more effective, and the dose can be reduced compared to the regular one.
Well, regarding statins, the lipid lowering agent is very difficult because 20 years ago I was one of the very much favor of statin because at that time we believed the lower the better, but when you use more and longer, you realize that there are a lot of side effects. Even though the serious side effect is not that often, but the minor side effect is quite significant because and actually interfere with a lot of other benefit that you would ask a patient to do, in particular exercise. When you use a lot of statin to lower your cholesterol, if you ask patient to do more exercise, there are some limitation because patient will get ache and pain in the muscle and get some joint discomfort. So what I usually do myself personally, this is out of the guideline already because the newer guideline is don't even look at the cholesterol level as you said. It has been recommended that anyone with risk factor should take the statin, which I don't think that's the way to go. I think that's too much for medicine and maybe some the commercial effect within it as well. But what I usually do personally is I will ask the patient and talk to the patient more about their daily activity, in particular a kind of exercise. I will ask them to do exercise more than what they usually do, and if statin actually limit their exercise capacity, I will reduce the dose of statin. And again, we'll have to look at other risk factors as well. If they have a very strong family history and if they have very high cholesterol, I would use it. But other risk factors should be considered as well. This is how the integrative medicine come into account for my practice. You should actually spend a lot of time with the patient and know what they actually do each particular day of their life. So you adjust the best treatment and offer the best treatment for them. And nowadays, when I'm getting old now, I believe the less medicine, the better. But they have to look after themselves as well. Doing nothing is easy, but you have the patient himself have to do something for themselves as well. In particular, food, diet, and exercise. And Dr. Payanut told you about diet already, but I myself do that very strictly, and I can tell you it is very difficult. And if you not enjoy it, you will increase the stress level in yourself, unfortunately. But it is possible. It is possible. You have to enjoy it first. Doing exercise is the same. It's the same thing. But as you may know, a lot of people choose the easy way out, taking one medicine rather than doing exercise and control their food or diet. So, as I said, you have to look at the patient, each particular patient, and adjust that accordingly. But at the end, hopefully they get the best out of us. I hope that answered your question.
I'd like to ask a question about chelation. I'm very excited that chelation is becoming more popular, and it's a way of getting rid of all those nasty heavy metals. But isn't it more effective to try and work out how those heavy metals are getting into the food chain and stopping that, rather than find a way of dealing with the problem once it's already happened?
Dr. Payanut said she's gonna mention that I am the expert in eating healthy food. To me, I think it is unavoidable that kind of food in our modern society now. You have a lot of contaminant or toxicity in it, more or less, because of the industrial process. And even fish that Dr. Payanut mentioned, there are a long list of fish that being recommended not to use in pregnant women in the U.S. But we in this Thailand, we never heard about it. But the story short is that because there are some toxicity within it. So to me, the way to avoid any toxicity or any heavy metal in our food chain is I recommend people nowadays to eat variety of it. Don't, as Dr. Payanut mentioned, don't eat one thing more often than the other. Like, for example, like soy milk. You don't just eat soy milk every day. If you do want to eat it sparingly. So eat everything in a small amount. There are many studies of food, which kind of food that will make you healthier, make you live longer. None of those studies ever come positive. Okay, and human being has tried that for 2,000 years or even longer, like in Egypt. Egyptian pharaoh, they want to make mummies and want to live forever, but nobody ever come up with anything. But one thing that has been proved continuously in both animals and in laboratory and in human that make you live healthier and live longer. You want to guess what kind of food? What food you can? There's only one thing of eating. No, not kind of food actually. It's eat less. Eat less. So you bring all the toxicity and all the heavy metal in your body less, because there is a study in animal. You give animal less food, and one group give a lot of food, and the animal that have less food live longer and healthier. And in human also, that you may have heard about people in Japan in Okinawa. That's the area that they live the longest. And you know what they eat? No, not only fish. They have a plate on their table, and what they do is they eat only 80% of it. That's it. And there are also some laboratory work that show that when you eat less, you have less inflammation. Your part of your chromosome has not been destroyed. So eat less and eat a variety of food. Don't eat one thing all the time. And I think you're right. Just to cut all the toxicity within the food chain in your body is very important. But to work outside of our field, like going to the industry, don't put any toxicity in water. I think that's also work, but it's too much work for us. But we should voice it. But who else? I mean, the other people have to do it. But for me, recommendation is eat less and eat variety of it. That's the only thing that to become healthy from eating, and enjoy it. I enjoy it. I just
Let me tell you something how he enjoy food. He eat apple in the morning. He enjoy tasting it differently each morning. The same apple but different one. Yep, that's how he enjoy the food. So if you want to eat healthy food like that, you have to change your mind how to enjoy the healthy food, because he eat the same one, right? You eat green apple, red apple.
And you can try many kind of apple, and that means that this is just example. It will taste differently, and it will come from different part of the world, and you get different kind of toxicity within it. That's how I think about it. So, and you can taste it. I mean, if you have your mind concentrate on it, it tastes very different, and you enjoy it. Like people who enjoy wine, but I enjoy something else.
Soy milk or fresh milk. you have to choose between Milo, Ovaltine, and also maybe vitamin soy milk, which is in the cap. Which one should be the best in your opinion? I ask for Dr. Priyanut. Thank you.
You know, I would not, not only me, in the specialists that work in the integrative medicine, now we know that our body may have something allergy to the milk product, and that can cause a lot of chronic inflammation as well. And we call it hidden allergy. That means you may not know at all that you have problems with it. It's not come as a rash. It's not come as a like swollen face or difficult to breathe, but it's come like maybe a little bit of tired, a little bit of pain, insomnia, bloating. So I would not recommend having milk, especially for the one that have health problems already. If you are healthy enough, you don't have any health problems at all, and you drink milk, maybe okay. But I would recommend non-fat milk. Okay.
Which will provide the most nutrition in your opinion?
Each food has different nutrition. Like milk, they have a lot of protein in it. They have a lot of calcium, which much more than soy milk. Okay, they have a lot of mineral and vitamin, and it's good in terms of their nutrition. And if you don't have allergy to it, soy milk also have the benefit of something else. They have less protein, they have less calcium, they has more antioxidant, has more anti-inflammation. If you drink, I prefer the thing that come naturally. If you get milk from the cows by yourself, not past the process, a lot of process. I will tell you something. Right now, processed food has a lot of problems now. It doesn't mean that we should not eat, but it's like make us aware that in the future, maybe something has to change. For example, it's just about a year or 2 years ago that there is study mentioned about lard. Lard, that is in Thai is called man mu. The oil that come from man mu that we use in the very ancient time, like our grandma, grandpa that use the skin of the pork and use it as an oil to cook food instead of using the oil in the bottle like we use today. And studies show that using this kind of thing may be better than using the oil that we use right now, because it's pure. It's not past all the process of hydrogenated, that kind of thing. And I also I went to the lecture in Surat Thani last month. There is one cardiologist study this kind of thing as well. So in terms of benefit, I think every food has benefit by itself. But if you can choose the fresh one. Choose the whole food instead of the processed food. I answer your question?
Okay. Last but not least, how about your opinion about the supplement food like brand or Scott, like chicken or nested? Comparing with the price and the benefit or nutrition we get, how about your recommendation? Is it suitable to buy and drink it usually? Thank you.
As I mentioned about food before, actually this supplement the kind of supplement is different than medicine. Modern medicine, the study that you have to use particular medicine and use it forever. So, but this supplement in the ancient time, we use this only for certain period and then we stop. So whatever you're gonna take, don't take it all the time. Don't take it continuously. Because there are many studies show that even vitamin E, vitamin C, hormone supplement, that people have used it continuously. At the end, it shows that you have a higher risk of developing heart disease. So this is something that I'm gonna tell you. If you take anything like that, you have to be very, very mindfulness, I would say, of your body, because you are doing. All of you, I think, practice meditation, and this is my experience. If you do meditation, you will know exactly what your body feel. You know state of your body. When you take those supplements, you have to feel what you actually get better. Okay? And once you get better, don't take it continuously. Just stop it. Because of the reason that I tell you before. And after a while, if you continue to do meditation, your body function drop. Like you feel more lethargy, you start taking it again. So I'm not sure whether I can. You understand what I mean? You have to be very concentrate on what your body function is all the time when you're doing this. Otherwise, you will get more. You don't get the benefit of those supplements. So to answer your question directly, I don't do it myself, and I don't recommend that to anybody. But if you want it, you can try and see what actually function of your body you feel better.
Guest speaker, thank you very much.